Welcome to the Deep Dive, where we cut through the noise, synthesize the most advanced research, and deliver the core knowledge you need to be truly informed.
And today, we are strapping in for a high-speed tour of the future of healthcare learning.
A future that, according to our sources, isn't really the future anymore. It's already here.
That's right. It's happening right now in allied health professions. We're talking about physiotherapy, nursing, occupational therapy, speech therapy, the core hands-on disciplines.
Yeah.
Our sources paint a picture of this really radical, rapid shift. Artificial intelligence, or AI, is no longer just a footnote in a textbook. It's functioning as an active educational collaborator.
And if you are a student, or have been one, in any of those fields, you know the struggle. It is very real. You're wrestling with these flat 2D diagrams trying to understand something as complex as muscle contraction or joint mechanics.
It just doesn't work.
Or you're trying to absorb just massive amounts of procedural knowledge, or you're completely overwhelmed by new clinical protocols.
Precisely. And the traditional ways of learning, they often fail to scale to the complexity that a modern clinician really needs.
So that's why we're doing this.
That's exactly why this deep dive is so essential. Our research confirms that AI is stepping in, and not just to automate tasks. It's making learning fundamentally smarter, far more personalized, and this is critical, more inclusive.
And it's preparing students for a professional life that is just. It's going to be thoroughly and permanently infused with this tech.
It already is.
Okay, so let's unpack this. Let's set our coordinates for today. Our mission is to move past all the hype and get a really concrete, detailed understanding of this transformation.
And we've laid out a clear roadmap for you based on the consensus from global research and these professional bodies.
Right.
So first, we're going to dive into the exciting, tangible tools. We'll explore the specific AI applications that are revolutionizing personalized learning.
Things like adaptive systems, virtual patients.
Exactly. Dynamic virtual patients, intelligent haptics. We're talking about tools that actively change the teaching process based on your needs as a learner.
Then second, we're going to tackle the governance side of things. How are the major global professional organizations creating frameworks for, responsible adoption?
This is all about accountability. It's about setting global standards for the future practitioner. You can't just unleash this stuff without guardrails.
Of course not. And then finally,
we will drill down into what is maybe the absolute core competency required for success in this new world. AI literacy.
And this goes way beyond just knowing how to use a piece of software. Right?
Oh, much further. It's about understanding bias, navigating what some of our sources call the alignment paradox, and really mastering the art of prompt engineering, but in a clinical context.
All right. It sounds like we have our work cut out for us. Let's get into it. Let's start where the rubber meets the road. The technology itself. For decades, allied health education has sort of operated on this mass production model.
One lecture for 100 students.
Exactly. The lecture was delivered, the textbook was read, the assessment was standardized, and if you fell behind, well, you had to play catch up on your own time.
And that model is being completely dismantled by the first major application we need to talk about. AI-driven adaptive learning systems.
So these are platforms that are supposed to eliminate that one-size-fits-all approach.
They do. They work by continuously, and I mean continuously, assessing a student's performance.
But tell us how this is really different from, a standard online quiz. How is the AI actually adapting? What is it looking at in real time?
Okay, so it's analyzing so much more than just whether you got an answer right or wrong. It tracks what you could call conceptual fluency.
Conceptual fluency.
Yeah, so not just if you got the answer, but how long did you take to answer? What's the pattern of your errors? Do those errors all cluster around one specific foundational principle?
Like, say, cardiovascular physiology versus, pharmacological interactions.
Exactly that. The AI is effectively building this constantly updated knowledge map of you, the student.
Wow. So let's make that real. If a student in a physical therapy course is trying to master gait analysis, and the AI notices they consistently misidentify the timing of the swing phase, what happens then? Instantly.
The system automatically modifies their learning trajectory right then and there. It might serve up a focused micro lesson.
Like a little pop-up video.
Something like that. Maybe a 3-minute targeted animation that explains only the swing phase mechanics, and it comes with a little self-assessment just on that one concept.
And what if they're getting it too quickly?
Then it adapts the other way. It might increase the difficulty of the next case study, forcing the student to apply that concept under more pressure because they're clearly grasping it.
So this really addresses that core challenge. I think it was Luckin and their team who talked about this.
Yeah.
You have to prevent the student who's thriving from getting bored, but also make sure the student who's struggling doesn't get, completely lost.
It creates a personalized safety net. And we're not just guessing here. The systematic review by Figerlova and others, it provides the empirical backing for this. They looked at customized practice, tailored explanations, all based on individual student performance across health professions.
Okay, so what were the tangible results from that review? What did they find?
The finding was pretty unambiguous. This customized practice and these tailored resources led to significant improvements. And not just in theoretical knowledge, but also, and this is so important for allied health and technical skills.
And why is that? What's the mechanism that makes it so effective?
It's clear when the AI addresses these little micro gaps in knowledge precisely when they appear, it reduces the cognitive load on the student.
Right. They're not trying to hold 10 confusing things in their head at once.
Exactly. It lets them build confidence and focus their energy where it's most needed. And that just accelerates how quickly they can pick up complex practical skills.
So the AI is shifting from being just a grader.
Yes. From a grader of the student to being an intelligent, responsive co-pilot on their learning journey.
That idea of a co-pilot, a collaborator,
Yeah.
that becomes even more obvious when we move into immersive practice.
Yeah.
I mean, we've all seen the static mannequins or those, kind of clunky VR exercises.
Oh, yeah.
AI is transforming those into dynamic, genuinely high-stakes environments through virtual patients and simulations.
This is a huge evolutionary leap. It's way beyond traditional VR, which historically was often just a sequence of, let's be honest, canned events. A leads to B leads to C.
A flowchart, basically.
Right. Now we have AI-based virtual simulated patients, or AI VSPs. And our sources, like Dimete, explain that these virtual patients have a level of sophistication that allows them to dynamically alter their symptoms, their mood, their responses, all based entirely on what the student says and does.
Okay, so if I'm a nursing student and I'm supposed to be assessing a patient's pain level, if my tone is dismissive, or maybe I miss a key nonverbal cue, the virtual patient doesn't just stick to the script.
Not at all. If the student fails to build that rapport, the AI VSP's, let's call it a nonverbal distress score, might go up.
Wow.
They might become defensive, their vitals on the monitor could subtly change, or they might even just refuse to cooperate with the assessment, which forces the student to adapt their communication, their entire approach, on the fly.
So that's the difference between just rehearsing lines and actually navigating a complex, unfolding clinical encounter.
Exactly. And this is so vital for developing true clinical reasoning, which, is the absolute cornerstone of allied health. You have to be able to think on your feet.
And you can do it in this dynamic, feedback-rich environment. You can practice your decision-making, your history-taking, procedural skills.
In a completely safe, iterative way, students can fail. They can fail spectacularly, and then immediately review their entire interaction, see where they went wrong, and learn from those mistakes without any risk of patient harm.
And the impact in nursing education specifically, that's been looked at pretty closely. There's a systematic review from Sengul and Sarikos.
Yes, and they look at exactly this, how these AI-driven simulations enhance learning outcomes. They found significant gains across the board in critical thinking, in technical proficiency. But the most fascinating finding for me was the observed improvement in empathy.
Empathy? How do you even measure that?
Well, it suggests that the realism of the AI VSP, the sort of human-like way it responds to good care or a lack of care, it moves the training beyond just procedure. It gets into the critical development of interpersonal skills.
So it forces the student to see the patient as a complex individual, even though they know it's a simulation.
And that's the idea. It connects the procedural skill with that human element of care, which is just, it's non-negotiable in these fields.
Absolutely. Okay, so now let's talk about the fields where the tactile sense is paramount. I'm thinking physiotherapy, occupational therapy.
Respiratory therapy, too.
Right. So we're moving from the visual simulations to these AI-driven haptic simulators.
Haptic simulators replicate the feeling of resistance or texture or force feedback. So for a physio student, this might be simulating the resistance of a stiff joint during immobilization.
Or the texture of a healing wound.
Exactly.
Yeah.
And traditionally, that feedback was based on fixed variables, but the AI integration, that's the game changer.
Because it provides intelligent coaching.
Intelligent coaching. The AI algorithms are measuring the student's actual performance against an idealized clinical standard, and they're doing it in real time.
So it's not just telling you that you applied resistance.
No, it's measuring the precise force vector, the angle of your approach, the duration of the pressure. It's detecting minute errors in technique. That's personalized, professional-level feedback that a human instructor just can't possibly provide to every single student at the same time.
And we have some pretty remarkable data that supports how effective this is. There's a randomized controlled trial by Kumar and his team. They looked at a VR platform combined with these AI-driven haptics.
And that data point is just, it's impossible to ignore.
What did it find?
The study showed that this combined system improved procedural accuracy by approximately 42%.
42%. That's a huge number.
It's massive. And when we talk about a jump in skill acquisition that significant, we have to understand the mechanism. The AI wasn't just scorekeeping, it was providing personalized, iterative corrections on force and angle, all based on the student's unique error pattern.
So it's ensuring they only practice the correct movements. It prevents bad habits from even forming.
That's it. You're not reinforcing your own mistakes.
What I have to ask, is there any chance results like that are a bit inflated? I mean, is a 42% jump an outlier, or is this becoming the consensus for this kind of skill acquisition?
It's a fair question, but the consensus from what we see in related studies points to the consistency of these gains when you combine simulation with intelligent feedback. The difference isn't just the tech itself, it's the AI's ability to perform these microcorrections over and over and over.
Because repetition is key.
Repetition is key, but only if the repetition is perfect. A human instructor can't supervise 100 repetitions perfectly for every student. The AI can. So that 42%, it reflects a much shorter training time and vastly boosted retention because the AI is ensuring this focused, error-free practice. It really validates the whole idea.
Okay, so beyond the hands-on procedural work, AI is also making the complex concepts that underpin all this practice, things like anatomy and biomechanics. It's making them visible and manipulable.
Right, which brings us to augmented reality, AR, and virtual reality, VR.
Traditional learning is all static 2D images or, those plastic models.
Which are fine up to a point. But AR systems, like the Hall of View system described in our sources, they project complex anatomical holograms right into the classroom or the training space.
So students can literally walk around and interact with a full-scale 3D model of, say, the human circulatory system.
Or a specific joint structure, yeah.
Yeah.
And then generative AI virtual assistants add that final layer of interactivity.
Right. Shang and his team looked at this.
They did. They focused on VR classroom environments where a generative AI assistant is integrated. So imagine you're standing next to a holographic model of the knee. You can use gesture controls to rotate the femur or the tibia. You can literally point at the anterior cruciate ligament and verbally ask the AI assistant.
What are the common mechanisms of injury for this ligament in running sports?
And the AI assistant can instantly synthesize the relevant clinical information, connect the biomechanics to potential pathologies, and adapt its explanation based on what the student is focusing on. It just brings the textbook to life in a way that's utterly impossible with traditional teaching.
It just removes that barrier between the concept and the application.
Completely. If a physical therapy student is struggling to visualize how specific tissues heal after an injury, which is a notoriously abstract concept, the AI can instantly render a 3D time-lapse animation explaining the cellular process step by step.
And it adapts if the student is confused.
Yes, it adapts the explanation if the student indicates they need more foundational information on, say, cell biology. In short, AI in education is about making learning adaptive, immersive, tactile, and just fundamentally more effective at building both practical skills and professional confidence.
So we've established that technology is revolutionary. The data on skill acquisition is, well, it's outstanding. But it's also new. How quickly are allied health institutions actually adopting it?
That's the question, isn't it?
It takes us right to the regulatory environment. Are the global professional bodies keeping pace with this explosive innovation?
They absolutely are, and that's the crucial point of this whole section. AI integration isn't just being tolerated, it's rapidly moving toward being mandated by global professional standards.
So it's not a choice anymore.
It's a global movement. It's driven by the necessity of preparing graduates for a future clinical environment that just demands tech fluency.
Okay, let's start with the big one. The global governing body for physiotherapy, World Physiotherapy. What's their philosophical stance on this monumental technological shift?
World Physiotherapy sees AI as a transformative tool, but one that has to be adopted ethically and based on rigorous evidence. Crucially, their position emphasizes that AI must support and enhance human skills,
Don't replace them.
never replace them. The core message is crystal clear. Technology is a powerful assistant. It's intended to elevate the practitioner, to ensure that physiotherapists, and by extension, all allied health pros, remain at the center of holistic patient care, just using AI to manage the complexity.
That distinction, support and enhance, not replace, that seems to be central to all the governance frameworks we've seen. Let's look at some specific national policies, starting with the American Physical Therapy Association, the APTA, in the U.S.
The APTA has been very forward-thinking on this. Their core message aligns perfectly. AI is a supportive tool, not a substitute for professional judgment. And their position statements, especially the recent ones, highlight a really practical benefit that resonates deeply with clinicians. AI's ability to significantly reduce the administrative burden.
The paperwork.
The paperwork. That's the real-world impact. We're talking about documenting patient encounters, drafting complex insurance reports, handling prior authorizations, coding, billing.
All the things that take time away from the patient.
Exactly. These tasks consume a massive amount of clinical time, pulling the therapist's focus away from the actual person in front of them. So by using AI-enabled ambient scribing or smart documentation tools, the APTA sees practitioners regaining that valuable patient interaction time.
And that, in theory, strengthens the quality of patient-centered care.
It should. But with that efficiency comes the need for a safety net. The APTA's digital health technologies policy has this powerful, non-negotiable caveat about human oversight.
Which is?
That's the accountability line in the sand. Therapists must retain ultimate responsibility for all patient management decisions, even the ones informed by AI.
So the AI can provide data, it can make suggestions.
But the human professional applies judgment, ethics, and empathy. The therapist is the final signature on that document, the ultimate ethical guardian.
And the APTA has gotten even more specific. They issued an advisory on AI-enabled ambient scribe technology. This shows they're moving past these broad philosophical statements into really specific applied use cases.
Yes, and that advisory sets out the practical requirements for using these tools day to day. It focuses on the need for high accuracy in the documentation, complete transparency in how the AI processes the data, and of course, stringent patient data protection.
It's about operationalizing AI responsibly.
Right. It's making sure that convenience never, ever compromises compliance or confidentiality.
Now let's shift over to the UK. The Chartered Society of Physiotherapy, the CSP, they echo a lot of these ideas, but with a slightly different emphasis.
They do. The CSP frames AI as an enabler for clinical and academic decision-making. Again, it's all about enhancement. But their guiding principles zero in on the ethical framework required for the technology itself.
What do you mean?
They demand fairness in algorithm design, protection of patient confidentiality, and crucially, they mandate AI literacy for all practitioners. That is a very clear signal to educational institutions about what future graduates must be able to do.
This emphasis on fairness and design integrity, that's becoming a global expectation, isn't it? It connects these specific physiotherapy standards to broader allied health expectations.
Absolutely. We see these principles get consolidated in the practical framework proposed by Hassan and his team for integrating AI into curricula across really diverse disciplines: radiography, nutrition, paramedic science.
A message is the same.
The central message transcends the specific profession. AI is powerful, but its integration has to be governed by ethics, accountability, and the non-negotiable requirement for human oversight.
And we even see this push for modernization reflected in legal frameworks in places like India, which sort of provides an enabling environment for this rapid tech adoption.
Yes, the NCAAHP Act from 2021. Now, it doesn't mention AI explicitly, but it mandates modern, standardized curricula and accreditation processes for all allied health professions.
So it creates the space for it.
It creates the legal underpinning. It encourages institutions to swiftly update their content and their teaching methods to incorporate these emerging technologies, just to ensure their graduates are meeting these high, contemporary, global standards.
What stands out to me here is the unified message. It's coming from every major professional body we reviewed. AI adoption is not optional anymore.
Not at all.
It is a necessary shift to make sure that allied health graduates are not only clinically competent, but also tech-savvy ethically grounded and fully accountable for their patient care decisions in this new digital world.
This collective endorsement, it really establishes this dual expectation for students. You have to develop technological fluency, but you have to do it with a deep understanding of ethical responsibility and professional judgment. The governance is in place to ensure that technology serves the practitioner, not the other way around.
The opportunities that AI presents are, they're immense. But as we just noted, with great power comes great responsibility.
Always.
Any technology that integrates this closely with sensitive patient data and critical decision-making is going to introduce some profound ethical and legal challenges. And every future allied health professional has to understand these.
The primary ethical challenge really stems from the basic necessity of AI, which is data.
It's hungry for data.
It's hungry for massive, comprehensive data sets. And in an educational context, this means using sensitive information, student performance metrics, biometric data collected during those haptic simulations, simulated patient medical records.
And storing and using that level of sensitive data requires adhering to extremely strict regulatory frameworks, things like GDPR in Europe and comparable patient protection laws all over the world.
Precisely. Institutions have to adopt robust governance practices from day one. Our sources, like Anagnostopoulou, stress the absolute necessity of anonymizing or pseudonymizing student performance data whenever it's used to fuel the AI's learning model.
But maybe more critical than just protection is transparency.
Oh, absolutely. Learners have to know exactly how their data is being gathered, what it's being used for, and how it's protected. If you don't have transparency, you erode trust in the very tool that's supposed to be helping you.
And transparency is key to addressing the issue that I have to say I find the most alarming, the risk of algorithmic bias. This is where AI's promise of objective efficiency just collides head-on with historical health disparities.
This is the critical moment in AI training where students have to develop a healthy skepticism. We have these historical disparities that get encoded into systems that are supposed to provide equal care.
And the canonical example here, it's detailed in our sources, is that study by Obermeyer and his team on a widely used U.S. healthcare algorithm.
It's a shocking study.
Walk us through what it revealed about the mechanism of the bias, because it's terrifyingly subtle.
It is. So the algorithm was designed to predict which patients were likely to have higher medical needs and then allocate additional care resources to them.
That's good, right? Sounds perfectly reasonable.
But it used healthcare cost as a proxy for how sick someone was. And that was the fatal flaw.
Why?
Because, historically, due to systemic barriers and biases, Black patients received and incurred fewer medical services than white patients, even when they had the same objective medical conditions.
So because the algorithm saw a lower historical cost for Black patients, what did it conclude, regardless of their actual need?
It concluded they were healthier. And consequently, the algorithm systematically gave less care, fewer referrals, fewer appointments with specialists, fewer resources to Black patients, even when their medical risk was objectively the same as white patients.
Wow. So if a physical therapy student is training on a resource allocation model or some diagnostic tool that's based on that kind of flawed data set, they could inadvertently internalize a biased clinical assessment.
Exactly.
They'd be thinking they're acting objectively when the system itself is inherently flawed.
That is the profound danger for allied health. I mean, if an AI gait analysis tool is trained predominantly on the movement patterns of one demographic, how accurately is it going to assess a patient from a different one?
Right.
If an AI nursing scheduler allocates resources based on flawed historical risk data, disparities just get wider. The required mitigation strategy is mandatory independent review and just total transparency in the design.
So systems have to be trained on diverse representative data sets from the very beginning.
From the outset, yes. And educators have to integrate lessons on algorithmic fairness directly into AI literacy training.
Beyond bias, we face the challenge of just preserving the professional's critical mind. Students, especially those who kind of inherently trust technology, they might fall victim to this blind reliance trap, just accepting AI outputs without applying human judgment.
Turner and his colleagues call this the alignment paradox.
The alignment paradox, what is that?
It's the daily balancing act. How do you leverage the efficiency and the advanced insights from the AI system while at the same time preserving your own professional autonomy, your ethics, and crucially, your empathy?
Can you give us a concrete scenario
Yeah.
in a clinical setting where this paradox becomes really acute for a student?
Sure. Imagine an occupational therapy student working with a stroke survivor. The AI suggests a highly optimized, evidence-based therapy regimen that focuses on maximizing motor function efficiency.
Okay, no, it's good so far.
But the student has spent hours building rapport with this patient, and they've noticed the patient is deeply depressed and resistant. They need more psychological support and gentler exercises to start with.
So the AI recommendation is optimized for function, but the human judgment recognizes the patient's immediate need is for connection and motivation.
Exactly right. The AI has aligned its recommendation to the data. It was fed pure motor recovery, but it has failed to align with the immediate human compassionate need of that patient.
So the student's non-negotiable skills, critical thinking, clinical judgment, empathy, they have to override the AI's data-driven efficiency.
They must. AI has to enhance, not weaken, the development of that deep human expertise. As Roger and his team warn, blind reliance just compromises patient safety.
Okay, let's pivot to the legal dimension. This is the issue that keeps developers and educators up at night. Accountability. When an autonomous or semi-autonomous AI system, say, a diagnostic support tool makes a consequential error, who takes the fall?
This blame problem is the legal frontier of healthcare AI. Is it the developer who created the flawed algorithm?
Or the institution that decided to buy it and deploy it?
Or is it the allied health professional who relied on the flawed output? And this complexity just gets exponentially increased when the AI system is used across borders, which complicates liability and regulatory approvals.
To make this real for a listener, imagine a paramedic using an AI triage tool in the field. The tool misinterprets some subtle patient data and advises against immediate transport, and it leads to a negative outcome. Who is held responsible?
In that scenario, the legal system just struggles because current professional licensing and medical liability are all based on human action. This is why we're seeing international consensus building around frameworks like the Future AI Guideline.
And what's the core mandate of that guideline?
It establishes consensus best practices for trustworthy deployment. It emphasizes the urgent need to strengthen liability mechanisms, to increase transparency about the AI's training data and its performance metrics, and to establish robust regulatory oversight across the entire AI lifecycle. Without these ethical and legal safeguards firmly in place, the integration of AI, despite all its benefits, introduces a significant and avoidable risk to patient safety and professional integrity.
The ethical challenges we've just discussed, the bias, data privacy, the alignment paradox, they all lead to one inevitable conclusion. The skill set of the future allied health professional has to profoundly shift.
It has to.
It is no longer enough to be digitally fluent. You have to be AI literate.
Absolutely. AI literacy is the new academic cornerstone. It's the ability to understand how AI functions, how data is processed, how to evaluate the AI's output critically,
And how to spot its errors.
how to proactively recognize its inherent errors or biases, and most importantly, how to use it responsibly to augment, not replace, your own clinical judgment.
It sounds less like a technical skill and more like a necessary form of critical thinking for the digital age.
That's exactly the framework that Kuznetsky and others proposed. They argue AI literacy should be treated as a core competency in higher education, right on par with academic writing or research methodology.
So the mandate is clear. The student has to treat the AI as this highly intelligent, powerful, but ultimately supervised junior colleague.
That partnership mentality is essential. It's what prevents the blind reliance we talked about earlier. If you don't understand the limitations of the model, if you don't know about the bias that's been baked into the training set, you cannot ethically take responsibility for the AI's output in a clinical setting.
The goal of AI literacy training, then, is control and transparency.
Yes. It ensures the allied health professional remains the captain of the ship. They're using the AI as an advanced navigation system, but they're always ready to manually steer if the system appears unreliable or biased.
Okay, so let's move from the abstract concept of literacy to the practical skill that really embodies it. Prompt engineering. If the AI is the collaborator, the ability to communicate with it effectively is paramount.
Prompt engineering is the practical application of AI literacy. It's the sophisticated skill of writing clear, precise, and contextual instructions to guide the AI system to produce accurate, tailored, and clinically useful results.
Because the AI is only as good as the instructions you give it.
It's only as useful as the quality of the constraints and the context you provide.
So let's use a clinical scenario to really illustrate the vast difference between a poor prompt and an expert prompt. Imagine a physical therapy student needs help generating an exercise plan for a complex neurological case.
Okay. A poor prompt might simply be, give me exercises for a stroke patient.
Right, and what do you get back?
You get a generic textbook standard list that lacks crucial patient context and is likely not clinically useful for this specific individual. It's basically a slightly better Google search.
Okay, so now let's apply prompt engineering principles. We need to define the role, the task, the constraints, and the format.
An expert prompt would sound something like this. Act as a neurological physical therapist specializing in early post-stroke recovery.
Okay, so that's the role.
Right. Then the context. The patient is 68, has severe right-sided hemiparesis but high cognitive function, and lives alone. Then the task. Create a 4-week home exercise plan focusing only on strengthening trunk control and left leg stability for safe transfers,
This is specific.
with minimal reliance on external equipment. Then the constraint. All exercises must be low impact. And finally, the format. Provide the plan in a 2-column table with the exercise name, its rationale, and specific repetition and set counts.
That is just. It's infinitely superior. The AI, when it's given that specific context, those constraints, that professional role, it moves from being a generic search engine to a powerful, tailored clinical support tool.
It understands the goal as safety and independent living, not just maximizing strength.
And that level of precision makes the output not just accurate, but immediately applicable to that patient's unique situation.
Exactly. Or imagine a nursing student using AI to synthesize a complex patient chart for a clinical handoff. A poor prompt is just summarize the chart.
And you get back an overwhelming wall of text.
An essay, yeah.
Yeah.
But the proficiently engineered prompt ensures you get actionable results.
So something like, act as a charge nurse preparing for shift change.
Perfect. Patient is post-op day 3 from a hip replacement. Task. Synthesize all vital signs, pain medication usage, and mobility progress from the last 12 hours. Constraint. Highlight any deviation from established post-op protocol. Format. Output. A bulleted list focused on actionable information for the incoming nurse.
That skill turns hours of data synthesis into a transparent, supportive process that really adheres to clinical needs.
And by embedding both this ethical awareness and this practical prompt engineering into allied health curricula, institutions are making sure that the student is ready to use AI confidently and effectively in their academic and, later, their clinical workflow.
They're graduating with that necessary dual skill set.
Technological fluency combined with human-centered professional judgment, ready to lead in a digitized healthcare environment. So, as we conclude this deep dive, let's just synthesize the monumental shift we've been examining. AI is undeniably redefining how allied health professionals learn, how they practice, and how they prepare for their clinical roles across all disciplines.
We've seen the incredible potential for personalization through adaptive learning, the power of immersive practice with those AI VSPs, and the huge skill gains offered by intelligent haptic simulators. These are tools designed to build competence and confidence faster and more effectively than ever before.
But the key, as we've seen consistently reinforced by global professional bodies like the APTA and the CSP, it remains balance. AI is explicitly intended to complement, to enhance, not to replace those core human qualities.
Your ability to apply empathy, to exercise critical judgment, to reason ethically, that's always going to be the most valuable asset you bring to patient care.
Absolutely. You have to leave your educational program with fluency in using these cutting-edge AI tools, yes.
Well, you have to pair that with a rock-solid foundation in human-centered ethics and critical reasoning.
And our sources, in their assessment of this transformative moment, they leave us with one profound, reflective practice question that we'd like to invite you to mull over.
The question is this: should AI be allowed to assess students' clinical performance?
Think about the tension that's inherent in that question. On one hand, AI offers this objective, data-driven efficiency. It can measure force, angle, and timing perfectly. It could potentially eliminate human subjective biases in grading.
But on the other hand,
we have the known risks of algorithmic bias, which could penalize certain groups unfairly. And we have the non-negotiable need to preserve and assess subjective human qualities. Empathy, communication, complex, context-dependent judgment.
how does an AI measure that?
Can it?
So considering the potential for this unparalleled efficiency versus the known risks of systemic bias and the need to preserve essential human expertise, deciding where that line is drawn for clinical assessment is a conversation that really highlights the profound responsibility facing allied health students as they navigate this digitized world.
It's a challenge that will define the very nature of clinical professionalism for the next generation.